politics of this.
All right.
We are being told, it's obviously being set up in such a way that the House is going to pass a bill with a public option. We will. And the Senate will pass a bill, if they pass a bill, without a public option. And they'll go to conference committee where they amalgamate the two bills, and they'll drop the public option. They'll come back to us and they'll say to people like me, to progressives in the House, hey, it's too bad. We tried. But this is it. Now you got to vote for it or against it. Are you going to vote against eliminating rescissions? Are you going to vote against all the other wonderful things just because you don't have a public option? Half a loaf is better than no. And the answer is, well, before I get to the answer, why would we be in that position? Because we'll be told, you've got to compromise. Well, we already have compromised. We've compromised at 5 different levels. First, we compromised by saying, all right, we won't insist on a single-payer system. We'll go with a public option. Then we compromised by saying, all right, Senator Obama, when he was senator, campaigned for president by saying, every American will have a choice of a public option. All right, we won't have every American have a choice of a public option. Only people who are unemployed or whose employer doesn't give them health insurance coverage. So we'll limit the public option. Then we said, we will, every provider, every doctor, every hospital who is in Medicare is going to be in the public option. Then we said, well, they can opt out. And then we said, but the public option will pay the providers at the Medicare rate, or at the Medicare plus 5% rate. And then at least one of the versions of the bill says, well, no, they'll negotiate, it'll be higher. Every time we compromise, it becomes less effective, and the checks on the insurance companies to keep the costs down and to give the services becomes less effective. We have compromised, or we're going to compromise.
That's right.
It's it. Now, how do you get it through the Senate? And this is the crucial point. The only way to avoid getting that position is to say, and to me, we will not compromise beyond a certain point. This is a line in the sand, and we will not vote for a health bill that does not have a public option in it, and you can take that to the bank. What we need is for the President and the leaders in the Senate to say, and first of all, to get rid of this nonsense about this illusion of bipartisanship.
Yeah.
We're not going to get Republicans. We're not going to get Republican votes, or no matter what the bill says. And I think they're beginning to realize this, or finally realizing it, or admitting it. And the fact is that when Senator Grassley, the Republican who was negotiating with Baucus, when he came out, he went home to a town hall meeting. You know what he said? About a week ago. He gave up the game. He said, and I'm paraphrasing him, I don't remember the exact words, he said, my aim in the negotiations was to prevent a bill from being agreed upon until after the break. In other words, what he was saying was, I was disingenuous, I was dishonest, I wasn't negotiating in good faith, I just wanted to delay everything, and I succeeded.
He's a Republican.
And that's what he said. He said it with those words.
That's obstruction.
And then he was asked, if a bill is satisfactory to you, will you vote for it? And he said, no. Not unless most Republicans vote for it. In other words, even if I agree with it, I won't vote for it. So they're telling you they're not going to vote for it. So what do we need? We need the President and the Democratic leaders in the Senate to get the votes on the Democratic side of the aisle. And how do you do that? You say to the rather few Democrats who don't want to vote for public option, you say to them, you don't want to vote for public option? Fine. You don't want to vote for the bill? Also fine. But you must vote to cut off a Republican filibuster.
That's right.
You must vote. If there's an up or down vote, there are the votes in the Senate for a public option. There are the votes in the Senate for a very good bill, if by the votes you mean a majority of the votes, not 60 votes. It's only in the last 10, 15 years, only in the last, since the 1990s, that we start seeing filibuster on everything, and they say you need 60 votes. No, what you need is spine. Spine in the front of Democratic leaders. Because no matter what else is in the bill, no matter how good the bill is, no matter how many people it helps, and it will help people, if it's a halfway decent bill, it will not be sustainable. For more than a few years, it will simply lead to a collapse of the system as the insurance companies take it all the way to the bank. And this bill cannot simply be an enrich the insurance companies bill, which it will be if there's no public option to hold them accountable. So this is our goal, and our method is to say to our senators, our 2 senators from New York, you must insist on a public option, and the way to get it through the Senate is to put the pressure on the few Democrats who won't go with the public option. Fine, but you got to vote against the filibuster.